Primary.
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 Survey.
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 Primary survey. Primary survey. Good day everyone, I'm Jason John Besido and this is the primary survey presentation of Group 1. The primary survey or the DRSABC is a quick way to find how will you treat any life-threatening condition of the casualty. It allows you to establish what level of first aid you need to administer and if you need to call the emergency services. First aid will split the primary survey into 6 steps. First, D is for danger, R for response, S for send or shout for help, A for airway, B for breathing, and C for circulation. This video will cover the 6 individual steps of emergency action plan for all incidents, the DRSABC. To start the primary survey, we have
D is for danger. First, survey the scene. Look at the left, right, up, and down. Check for any signs of hazards or environmental dangers present that could cause harm to you, the bystander, and the casualty. Ensure that the area is safe before conducting first aid.
R stands for response. After checking if the surrounding is clear, approach the casualty and check for the response with your gloves. You need to get the response so that you will know what is wrong with them. To do this, use the ABP scale, which helps you scale the level of response from the casualty. A is for the alert. This is when the casualty is conscious and aware of your presence and responses appropriately. If they are not awake or conscious, proceed to B. B is for voice. Introduce yourself. For example, "Hi, mom, sir, I'm blank, your name, and I'm a certified first aider and I'm going to help you." Or ask them questions as you approach them. For example, "Mom, sir, can you hear me? Can you move your hand?" If they did not respond to your voice, proceed to P. P is for pain. Kneel beside them and gently shake their shoulder and use the touch and talk method. "Hey, hey, hey, are you okay? Hey, 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 are you okay?" To establish if they are conscious, semi-conscious, or unconscious. If there's still no response, you can pinch their earlobe or index finger if they will respond to the pain. If the patient is semi-conscious or unconscious, proceed to U. U is for unresponsive. At this point, you can assume that the casualty is unresponsive.
S is for shout for help. Find someone near the scene whom you can ask to call for the nearest emergency service. Point the person and classify according to his or her clothes so that he or she could recognize that you are calling them. Ask them to call the emergency services for assistance by dialing 911 or 143 as soon as possible. If you are alone, put your phone on speaker mode and do it yourself. If the casualty remains unconscious, then
It's A for airway. Look inside the patient's mouth for any foreign objects, and if needed, remove them by using the head tilt and chin lift technique. Turn him in a recovery position to keep the airway clear and to prevent choking. Tilt their head slightly downwards and use a finger to remove any bulky objects near him. Before tilting him onto his side, hands supporting his head, and place the knee upper side once the airway is clear, then check.
B for breathing. To check the casualty's breathing, you will face your cheek in front of their nose and mouth. While doing it, see the casualty's chest area to check if it's rising or falling. Look, listen, and feel for normal breathing. Do this for at least 10 to 15 seconds. If the casualty is not breathing normally, begin CPR.
C for circulation. Check to see if the casualty has pulse. If the person does not have a pulse and the patient is unconscious and not breathing normally, start CPR. Give 30 compressions. Start chest compressions. Place the heel of your hand at the center of the victim's chest. Put your hand on top of the purse with your fingers interlaced. Press down and compress the chest at least 2 inches in adults. Allow complete recoil after each compression. Compress continuously with both hands at a rate of 100 per minute or more. Continue delivering 2 breaths and chest compressions until help arrives. An automated external defibrillator or AED is available, or the emergency personnel arrives, or the victim is revived back to life.
And this is the 6 individual steps of emergency action plan for all incidents, the Drsabc, or the primary survey. I hope that you have learned a lot from this video and you'll be able to utilize this information. We appreciate your time watching this video. Again, I'm Jason John Besido, and this is a primary survey presentation of Group 1. Thank you everyone, stay safe and God bless.